Yeah, we ready?
Yeah.
Okay. Hi, my name is Phil Brewer. I'm a member of the steering committee of Jewish Voice for Peace Health Advisory Council. I'll be the moderator of this program. Alice Rothschild will be recording the webinar and monitoring the chat for questions that you can submit to the speakers at any time. I'd like to welcome everyone to the program. This is the 24th of a series of webinars organized by the Health Advisory Council. In the past, we've produced a webinar approximately every 3 months, but because of the remarkable acceleration of events in Gaza and now the West Bank, we've increased the frequency to every 4 to 6 weeks. Each program has an emphasis on obtaining the perspective of activists and experts on the ground who can give both their personal and professional assessments related to the specific topics of their presentation. As I mentioned above, this is being recorded and will be accessible on our website for later viewing. If you wish to not be seen in the recording, you can turn off your video, which most of you have it turned off at this point, and remove your name by clicking on the three dots that allows you to rename your little square. The topic of today's program is Healthcare Under Fire in Gaza, Reports from the Ground. The speakers will be Dr. Seema Jilani and Dr. Aram Ali. They'll each have 15 minutes to present their perspective on today's topic, following which they will respond to questions from Dr. Rothschild and myself. We will then open the floor to questions from the audience, which again you may submit through the chat, and the total time of the program will be 90 minutes. Now I'd like to introduce Dr. Seema Jilani. Dr. Jilani is an assistant professor at Baylor College of Medicine and Texas Children's Hospital. Her work has taken her to Afghanistan, Syria, Iraq, the Balkans, Ukraine, Gaza, and the West Bank over the past 20 years. And I neglected to mention Lebanon, and she was actually in Beirut during the explosion that occurred and has a very interesting YouTube video outlining that experience. So she's seen a lot. She's also treated migrants on rescue ships in the Mediterranean, identified bones from mass graves in Bosnia, and responded on the scene after the 2020 explosion in Lebanon. She's worked for the International Red Cross and Red Crescent, the International Rescue Committee, as well as other non-governmental organizations, and has been featured in the New Yorker, the Guardian, the BBC, and the New York Review of Books and GQ Heroes Edition, and the New York Times, where she has been a contributing writer for over a decade. She recently briefed the United Nations Security Council, the U.S. Department of State, senior White House administration officials, including members of the National Security Council and the Senate Armed Services Committee. Dr. Jilani is a senior Fulbright scholar, a Truman National Security Fellow, and a nominee for the Peabody Award. Dr. Jilani, the floor is yours, and we're honored.
I'm so very honored to be with you all. Thank you for everyone joining us. And I would love to take a moment to just pause and really thank our audience as well. These are heavy, heavy subjects and heavy topics, and you are choosing to engage, and I so respect that. Everyone has busy lives, and I'm very honored to be with you this evening. I believe we're starting with Dr. Ali or Arham, and we can do those introductions, and then I can follow up after.
Oh, I beg your pardon. I
Oh,
thought you were going first. So let me go on and do Dr. Ali's introduction. Um, and so Dr. Aram Ali is a specialist in pediatric intensive care at Loma Linda University Hospital in California. He recently returned from volunteer service in the pediatric intensive care unit at the Emirati Hospital in Gaza and has published an article in the April 2024 edition of the Journal of Social Medicine entitled Cries from Palestine, a Call for Action from Pediatric Providers. He was interviewed on the Electronic Intifada regarding this experience, during which he witnessed pediatric patients with severe burns, major trauma, and severe malnutrition and dehydration. He described the staff being forced to mix infant formula with seawater due to the lack of clean fresh water as just one example of the dire conditions in which he was forced to provide care. And he will now discuss this experience in detail. And Dr. Ali, we're also equally honored to have you here.
Good evening, and thank you for the kind introduction. I will echo Dr. Jelani's statements as well, and that truly I admire the entire audience. I understand that everyone has their own personal views and their own family obligations as well, and to take time out to speak about the active issues that are going on in Palestine right now truly means everything to me. So thank you very much. I'll just go ahead and share my screen here. Okay, is everyone able to see that? Okay. Wonderful. All right. So just as some quick disclaimers here, in February, I did go for a medical mission in Gaza, Palestine. And I was there for 2 weeks of duration. I also must disclose with full sincerity that I am biased towards the following basic human rights: the right to life, freedom, shelter, education, and for dignity, which unfortunately seems to be quite controversial in the current state of affairs. Now, some of the most basic determinants of health are food, water, shelter, and medical infrastructure, each of which requires reliable access to fuel and electricity. Repeated hostilities in recent years have caused tremendous levels of destruction of physical infrastructure and loss of human life. According to national humanitarian law, while acting as the temporary occupant, among Israel's most important legal duties is to respect and to preserve the fundamental rights of the protected population under international humanitarian law. The current conflict has led to a near complete blockade, severely restricting the flow of essential medical supplies and humanitarian aid in what remains of Gaza today. Pre-October 7th, the daily average of aid trucks entering into Gaza was just under 500. Despite the overwhelming needs during the current bombing campaign, aid continues to be restricted. In fact, according to the UN, only 6 convoys were able to deliver aid into North Gaza in all of February. And since the disruption of the Rafah crossing by the Israeli military, the numbers are even more abysmal. So to give you a little bit of context, my medical delegation, which was composed of 6 medical delegates, we brought in 50 bags, 50 bags. And nowadays, unfortunately, each individual is only allowed to bring 1 suitcase. Even that is heavily restricted, and they're unable to bring in any medical aid. Traveling across Gaza's coast was a harrowing experience as it splits 2 seas. To the west was the Mediterranean, and you could watch as the waves crash against each other and against the sand dunes. While to the east, there's waves of tents which crash up against one another as far as the eye can see. The sky above them was littered with kites, buzzing drones, and a thick cloud of smoke. Sanitation plants have been bombed and sewage flows like stream through the streets. Makeshift beds inside tents were positioned such that rainwater and sewage flows through the tents in between the beds. The conditions are ripe for communicable infections and a plethora of mite-borne skin diseases. We'll discuss infectious diseases in a bit more detail in the next upcoming slides. Geospatial analysis in this particular study done by Harvard identified that within 46 days, much of critical civilian infrastructure, i.e. health facilities, education facilities, and water facilities, were completely damaged or destroyed. Furthermore, spatial analysis of infrastructure damage demonstrated a non-random pattern and statistically significant clustering of damage around critical civilian infrastructure. The scenes in Gaza were apocalyptic, as whole neighborhoods have been completely erased and completely destroyed. This video right here was taken amongst the streets of Khan Yunis in February earlier this year. The recent collapse of healthcare infrastructure in the region is not merely a statistic or a news headline. It's a grim reality, claiming innocent lives every single day. Per Doctors Without Borders and the World Health Organization, hospitals in Gaza are at a breaking point and struggling to take care of the influx of patients. The lack of basic medical necessities like antibiotics, surgical supplies, and even anesthetics means that treatable conditions can quite often become fatal. Surgeons were operating on children without anesthesia. And it is reported that a surgeon operated on his own niece on the kitchen table without any anesthesia. The hospital in the video seen here has now been besieged. This is the European Gaza Hospital in Khan Yunis. When it was partially functioning, this is what it looked like. And you'll see here, this is actually during the holy month of Ramadan, in which Muslims in the region are fasting and praying, fasting during daytime hours and praying here, as you can see in the video on the left. And you can see here, as these medical delegates start to go down the stairs, you can see that there are displaced civilians here in the hospital trying to sleep here on the stairs. They have tents on the stairs, and the entire hospital is just littered with refugees, making it difficult to maintain sanitation and to maintain a level of calmness. In this video here, see if I can get it to play. The children you see here were excited to see that someone delivered them some new clean jackets to wear last winter. The innocence of childhood prevented them from realizing the truth that these jackets were in fact body bags. During my time in Rafah, I witnessed a teenage male walking barefoot in the mud, utilizing a body bag as a jacket. The grim reality is that the makeshift jacket of his likely served its intended purpose long before he ever attained the warmth he sought out for. A common rhyme sung by children here in the US has been modified for the children of Palestine. Here in the US, we say, no more pencils, no more books, no more teachers' dirty looks. Whereas in Palestine, it's no more bombing, no more deaths, no more asking, are we next? Here we visualize aid being airdropped in the northern Gaza Strip. Are you guys able to hear that sound as well? In audio right now? Okay, that's all right. Let me just pause it really quickly. So unfortunately, the entire time while you're there, you can just hear this constant buzzing of drones. And I cannot imagine how the people there felt as there were children there who had only ever heard these voices their entire lives. They had never lived a day in peace, free from discrimination or terror. And in contrast to the previous picture, this is what aid looks like from the view of a Gazan child. And yet the West cheers on as this so-called aid drifts into the sea, lands on tents, crushing families, and serves as a fruitful opportunity for the IDF to live out their wildest dreams. You can see here in this ER, it's just littered with patients, with healthcare staff, with family members, everyone, all hands on deck, trying their best to mitigate the situation. And this picture here to the right is of this man that was, underwent a anesthetic surgical procedure. And unfortunately, you can see that not only had this man lost his actual eye globe, was actually amputated, but also that his eye socket had become infected as well, filled with maggots. Now, the Gaza Strip had been polio-free for the last 25 years. Its reemergence, which the humanitarian community has warned about for the last 10 months, represents yet another threat to children in Gaza and neighboring countries, per the WHO. Now, I personally had done my training in Karachi, Pakistan, so I'm very familiar with seeing polio and seeing its debilitating, burdensome, and preventable effects. And what hurts me the most is that in Gaza, 99% of the population was vaccinated against the polio virus prior to October 7th. And unfortunately, all of those new children that were born, it's estimated at least 50,000 children have been born in Gaza since October 7th. It's very unlikely that any of them had received any polio vaccinations. More than 1.6 million vaccine doses are due to be delivered into Gaza, along with the necessary cold chain equipment. The polio vaccine is administered orally, and the aim is to provide 2 drops of a novel oral polio vaccine to over 640,000 children across Gaza under the age of 10. The WHO has over 700 teams made up of 2,700 staff members ready and available to deliver the vaccine at different hospitals, field hospitals, and primary care centers, should they be allowed to do so. Now, the benefits of oral administration are the ease of administration and that a large number of patients can be vaccinated pretty quickly. The kids are asked to tilt their heads back, and 2 drops are administered. Again, as someone who has trained in Pakistan, I have administered hundreds of these doses of this vaccine. However, in Gaza, the vaccine administration looks quite different. As children tilt their heads back, they visualize the constant surveillance and bombing tactics by the IOF as visualized in this graphic. The previous picture is best described by this healthcare worker in Gaza, who states, "The painful reality is that these kids will be vaccinated in the morning, and then as the medical teams in the hospital will receive some of these same patients and some of these kids at night as casualties from bombardment and airstrikes in the evening." In addition to poliovirus, there's a plethora of other communicable diseases, many of which are preventable, including 990,000 cases of acute respiratory infections, over 500,000 cases of watery diarrhea, 12,000 cases of bloody diarrhea, and over 100,000 cases of jaundice. This is all measured since October 7th until July. For healthcare providers and staff, death is increasingly inescapable. Many of the doctors here describe having been tortured and seeing many of their medical staff members tortured as well. Gaza Medic Voices, which is an organization set up by international medicals, provide firsthand account from Gaza, shared the following testimonies. They tied our hands behind our backs, our knees, our heads on the floor, 13 hours without food, water, or the bathroom. What has happened to the doctors, patients, and internally displaced people here is unbelievable, even in your worst nightmares. They were forced to strip. There's various different forms of humiliation. They were getting hit in the face. There's dogs involved. There's electricity involved. The director of Al-Shifa Hospital and fellow pediatrician, Dr. Mohammed Abu Salmiya, has alleged that the medical staff in Israel's military-run detention centers are participating in beatings and are denying essential medical aid to detainees, leading to amputations and death. 10 years earlier, in 2014, Israeli doctors were accused of complicity in torture, and the Israeli Medical Association failed either to respond or to fully investigate their charges. And 3 years prior to that, in 2011, a report by 2 humanitarian rights organizations, including Physicians for Human Rights Israel and the Public Committee Against Torture in Israel, found that doctors were involved in torture and in violation of their ethical and moral obligations. There are many reports dating back to 1996, all with the same unfortunate, similar outcome. As we know, death and torture and injury to children is not just limited to Gaza. The West Bank is also being affected. These numbers, unfortunately, are even outdated, despite them being as recent as of May 31st. But you can see here that there were 502 Palestinian deaths in the West Bank from October 7th until May 31st, including 122 children. The IDF had killed 485, and concerningly, Israeli settlers had killed 10 of them, and over 5,100 were injured. And to that same vein, unfortunately, there were many Israeli deaths in the West Bank as well, 6 of which were Israeli soldiers, and 4 of which were settlers. The image to the left is bread that's formed by the amalgamation of rabbit, donkey, and pigeon feet. And this is what the people there are trying to survive on, unfortunately. Per the UNICEF, 1 in 4 children are enduring famine-like starvation. For the integrated food security and phase classification, Gaza right now is facing the highest amount of food scarcity and food deprivation ever recorded. Here's some quotes from UNICEF's communication specialist team, Tess Ingram. She provided 4 quick examples that speak to thousands of women's experiences. So we're talking here now about many of the pregnant women that are in Gaza. So Iman, she ran terrified while 8 months pregnant through the streets of Gaza City when it was under attack. She was too weak to hold her new baby. Mishael says that it's best that her baby isn't born into this nightmare. Amal was buried under the rubble during an attack while 6 months pregnant. And Nurse Wabda had performed emergency cesarean sections on 6 dead women in the last 8 weeks. And this was a common finding that we saw throughout Gaza. Gaza is described as a graveyard for thousands of children. It's a living hell for everyone else. Evacuating injured children from Gaza is limited by Israel. And unfortunately, or I should say, prior to October 7th, healthcare was quite integrated for Palestinians, for those that were able to make it across the border. These mothers faced unimaginable consequences and challenges trying to deliver. And I heard unanimously from parents, from siblings, and from healthcare providers that those children who defied the odds and survived past infancy face the ongoing perils of occupation, dehumanization, and the constant threat of permanent disability and or death. Skip over that slide. And finally here, I would just like to state as part of my closing statement that I am forever grateful for the courage displayed by my Jewish brothers and sisters who call out this hypocrisy. Many are academics, researchers, and higher education professionals. They are appalled by and refuse to accept the deliberate mischaracterization and weaponization of persisting fears about Jewish safety. They rightfully denounce the misconstrued narrative pushed by their Israeli media and alike. And then here we can see Jewish healthcare workers standing arm in arm with pro-Palestinians at the Dolby Theater during the 96th Academy Awards here in Los Angeles. Thank you. I'll move it on to Dr. Jelani to proceed forward with her presentation.
Thanks very much. I appreciate that. I not only served as a clinician on the ground and can certainly share my experiences there, but I also served as senior technical advisor for emergency health for the International Rescue Committee. And part of that job, or the entirety of that job at that time at least, was to lead on the development of our healthcare response as one of the major international NGOs. So I learned firsthand around the challenges around trying to get medical teams inside of Gaza. I did spend time there. I was there from December 25th of last year through January 8th. And I also led on emergency health medication and medical supply procurement, designing safety and security around deconfliction. So, Arham has provided a really incredible micro look at what things on the ground in Gaza can look like. And I'd want to step back for a moment and see, how do we even get there? What are the steps needed to be able to get into Gaza at the moment? And talking a little bit about how it is an island, it is a prison, and it is completely cut off. So when people often ask, what is the difference between this conflict and every other that we're seeing, having been in multiple areas of conflict and war, I can say there is nowhere to go. There is the sea, and they are being attacked by land, air, and sea. So first, let's talk about, before we even get to the border, what can we get in for supplies as a massive American based with strong UK ties, international rescue? What were we able to procure, get delivered, and get inside Gaza? And now everyone has the same alerts, I'm sure, across the humanitarian aid community. How many trucks have crossed today? It doesn't matter if those trucks sit on the other side of Rafah and those medicines rot in a warehouse because they can't get to where they need to get. The distribution and the delivery of aid is entirely and reprehensibly prevented from moving along some very, very unsafe areas. It is an orchestrated anarchy. It is completely preventable and entirely engineered that we are seeing a systematic dismantling of an otherwise robust healthcare system. And I want us to really keep that in mind and be intentional about how we think about Gaza. A very, very highly educated, high capacity healthcare workforce that knows what they're doing and has worked under a blockade and has worked under extreme situations and extreme circumstances for decades upon decades now. They are not naive to conflict. They have been able to maneuver a system to be able to get supplies in, and are again highly educated. And I learn every time I have been in Gaza. I've been in 2005 with Dr. Alice Rothschild, again in 2015 with Dr. Alice Rothschild, and then again in 23, 24 during this conflict. So that's the first. So let's talk about how are we negotiating at that time, at least, to get goods across? Well, there's something called a dual use list, which is very unofficially what the Israeli authorities have designated are not items that are not allowed into Gaza for reasons that they have deemed will place the Israeli population at risk, or they see as items of war or activities of war. They do include chemotherapy drugs. They do include water sanitation tablets, water sanitation testing materials, and any construction materials. Now, officially, there have been reports that they don't subscribe to this, but we all know in the aid world that you will not be getting things across the border if anything on the dual use list is indeed on your truck, and they will send an entire truckload back of diapers. I personally have witnessed a truckload of diapers be sent back. And if anyone who's ever been through a checkpoint here, I'm sure there are many that are joining us, knows that it is not always written what is and isn't allowed. It often can depend on the mood of the officer at the checkpoint that day, and whether they are having a good day or not, or if they're appropriately caffeinated for them to be able to send across whatever is needed. So that's the first thing, is working. And as an aid organization, we tend to do a lot of water sanitation and hygiene. What we would typically do, for example, in Sudan, is build latrines where women feel safe, with gender segregated latrines where women feel safe in the middle of the night to go and have some modicum of dignity with their feminine hygiene products, pregnant women, others, and be able to, again, have some modicum of dignity. But if you can't construct those latrines, you end up with what Arham was talking about: sewage in the streets, infectious diseases, things, again, entirely preventable. So we were unable to construct those latrines, and unable to provide, when you're writing a grant proposal for any of this funding, you have to be able to proof of concept. And it's very unfortunate. We are oftentimes very difficult to do so. When the trucks do get across with whatever they get across, they are relegated to specific checkpoints at specific times. Now, it has been asked, and I have specifically advocated, along with ceasefire, working under these conditions, can we have the Israeli authorities open the checkpoint earlier? Can we ensure Israeli authorities? So we are trying to work within the system. I think that that is often lost, is how we are trying to work under such extreme circumstances. And of course, Palestinian healthcare workers are at the front lines of this. And so we have asked for specifics. Can we get soap? I mean, I really want to emphasize, there are many people that have given up on ceasefire, and we're relegated to asking for soap for children, for skin infections, for impetigo, which is like a very easy disease to treat, a skin infection disease in children, very easily treatable, but if not treated, can progress, and often do. And so that's one other thing I want to talk about, is not just the bombardment and not just the injuries to limb and life and traumatic amputations, but also those that we could have saved. That's what gnaws in my head. The ones we could have saved had we had the facilities, had we had the personnel that didn't have the doctors there would often describe the stethoscope as a target on their back, and they would take that off. Then you crossing across. So the other things that are not allowed in include some pain medicine, like ketamine, for example, which we use in pediatrics very often for suture surgical and procedures and shoulder dislocations, all sorts of things. So the other request that has not also come through is distribution of the delivery of aid, as simple as dignity kits. There were things that have been turned back, include sleeping bags, because they are green, and green is a military color. There have been concerted efforts from other governments to do medical evacuations. after all of the paperwork and everything was completed, the response came back that the medical evacuation, the vans that were going in were not green energy. This is a true story. I would ask how much the carbon footprint of a bomb in Gaza is today and return to that. The other thing, of course, is that we used to talk about the fall of cities, the fall of Mosul, the fall of Saigon. And I want to ask us to kind of understand when it became normalized that we're talking about the fall of hospitals now. Fall of Al-Shifa, European hospital, Indonesia, and one by one, this sort of crescendoing all the way down, and then sort of ramming its way through Nasser Hospital, and each one, and then we're sort of watching this landslide, this onslaught of and of grief, and accepting it as the new engagement of the rules of war. It is very dangerous if we want to call ourselves as governments and people that abide by rules of war to call into question the rules that we have in place. It is dangerous for the next conflict, which might very well be at our door. The example I give, for example, is hospitals by nature are what we would call deconflicted. They are areas that are supposed to be protected. The next step in getting into Gaza is making sure that at every level it is deconflicted. So, which is what we did. So our guest house, we were one of the few that stayed in a guest house and brought our own food and supplies so as not to take rations and supplies from the already strained population of Gaza. Deconfliction means that you have notified the Israeli government and authorities that this is a safe haven of aid workers and they are not to be touched, and they have agreed to this. This works this should work in Ukraine. Works. I will be very honest that I have deconflicted better with the Taliban in Afghanistan than I have with Israeli authorities. And I have said that sentence to many senior White House officials. I do not agree or subscribe to most, if not 100% of what the Taliban stands for. I will say that when they show up to protect your hospital and they say you're not going to be touched, we were not touched in that way. That is not true for the Israeli authorities. I will also reiterate, I find what the Taliban does abhorrent on many levels. The deconfliction was indeed identified and agreed upon. Later in my term there, a bullet went through our ICU. Leaflets were dropped. We were unable to return to the hospital due to fear for our lives. And a week after I left, even though our guest house had been deconflicted, so-called, under the highest levels of government and authorities, it was bombed. An independent investigation by the UN Mines Association was called within hours. Israel has provided no less than 6 explanations, including a denial that it was them. And there's been no accountability. There were 6 doctors and a Palestinian family with children. There was luckily no one killed, but there were people that were injured. And the reason I bring this up is, again, is adherence to the rule of law, where they have called into question the credibility of that investigation. If we're calling into question the credibility of independent investigations like the UN, this is a very, very dangerous place for us to be in right now. Because when that conflict is in anywhere else, we don't have the backbone to stand up and say, actually, what do we stand for? That this is unacceptable. And you can look at the weapon that was used. It is an American weapon. So I think the grotesque disregard for human life is certainly on display. What I can say anecdotally, the proportionality of children that I was seeing is unlike any other conflict I have seen. 4 out of the children who were in the resuscitation room or the code room at one point, 4 out of 5 were children under the age of 15. I want to highlight and center the Palestinian healthcare workers that were not once or twice, but oftentimes 3 or 4 times displaced, that they are very hyper aware of what is happening, very aware that the world is watching this, and they are showing up, stethoscope in hand, seeing their patients, and just valiant work under unconscionable situations. And then as you're entering Rafah, as we were in central Gaza in Al-Aqsa Hospital, what you see coming down at that time, because they were told Rafah was safe, is a total sea of human tragedy. Babies falling asleep, children nursing, trucks, donkeys, anything that can move, people barefoot, as you said, looking for garbage bags to make tents out of. And you just, cats, pets, just all huddled together trying to look for safety. And you think they have done that so many times at this point that it is, I have no words for what they have gone through at this point. And then I will say the other thing is that within my first 30 minutes of being there, I saw a child who was about a year and a half years old, and had no right arm, right leg, and what we have witnessed with regard to devastation of people's lives, I think I have not seen elsewhere. That baby likely bled out, and of course, anywhere else in the world would have gone as an emergency, what we call stat case, to the operating room. But when I contacted the orthopedic surgeon, he said that there's other critical cases, which really begs the question, like, what is more pressing than a child with no arm and no leg? And it tells you the gravity and the severity of what we have witnessed there. I would also highlight, when I was there, I specifically held a man's hand he was about 20 something years old, on the floor. He died in my arms, and all he asked for was water to be pressed to his lips. And as we were cutting his clothes to assess his chest, we realized he had his UNRWA jacket on. So these, again, are supposed to be protected workers. So I think that kind of tells you a little bit about the scale, magnitude, and severity. And of course, then we talk about burn and traumatic burn victims. And then we can also extend that into have something like hepatitis A, which otherwise would be treatable and self-resolving, but under these conditions leads to children needing liver transplants. I'll end there because I know I do have a couple of photos I wanted to share with you from my time elsewhere as well. And would like to get into our discussion with our participants. This is a patient here. I was doing ward rounds. This is a patient, and I bring this to your attention. First of all of these have signed and documented consent, so I want to ensure that that is known here. And in this room must have been at least about 7 to 8 mothers in a room that would otherwise, with their children, would otherwise hold maybe 1 or 2 children. Families, remember, are crowding in or seeing hospitals as safe zones and areas that they can evacuate from. And then, of course, as soon as the leaflets drop, everyone disperses. About 6 out of the 8 women were unable to produce breast milk in this one room because of the dire nutritional circumstances. And you can move forward on the slides. This is a picture from 2015. This is a Banksy photo that after the 2014 incursion that this is an artwork by Banksy, actually. And when he was asked, why are you drawing a giant kitten with a pink bow amidst this absolute devastation, his answer was, I want people to think and care about Gaza, but people on the internet only want to look at pictures of kittens. So here you go. I thought that was really powerful. And Dr. Rothschild and I were witnesses to the resilience of the people of Gaza when there were kids doing parkour off of this. It was a really moving moment. Next, please. This is another photo. So people brought in of trauma in the hospital we were working at, people brought in by foot, donkey, car, if you're lucky, because gas is on the black market, and you can kind of see the chaos there. Next slide. This is from Bosnia, and I bring this up because we talked about the food rations. So Bosnia, again, a very high capacity, highly educated people that was watching as the world watched them starve. And I can say with fully fledged assurances that this was declared a genocide by the ICTY and ICJ. So So these were what the West at that time dropped as aid. So the West at that time dropped as aid canned beef. And the joke is, and it's not a joke, that cats, war-torn cats in Bosnia and Sarajevo that was under siege by Serbs all over would smell this beef and run the other way. It was so disgusting. They were often left over from the Vietnam War. They often had pork in them, and we know that population doesn't eat that. Several years after the war, there were Bosnian artists that were asked to put up a monument to thank the international community for what they had done for Bosnia. And as they unveiled it, this was it. And it just, for everyone there, it just completely was a light bulb moment. And the inscription reads, and I'm butchering the translation, from the grateful to the international community, from the grateful citizens of Sarajevo. And so I want us to not have a monument in Gaza that is a food can. Can you, next slide? I'll move quickly because I think this is a repeat, excuse me. Oh, okay. I think that's it. Okay, I'll wrap up my time there. Thank you.
Okay.
Well, I'm not sure what to say. I'm not sure anybody knows what to say. Thank you both for your witness, what you've done and your witness. The world can't say they didn't know, and I've heard that repeated many times, and I think it's an important point to make.
I would like
Alice,
to just,
yeah, Alice,
yeah,
go
I
ahead.
just wanted to, I mean, this was, horrific and moving and powerful and horrifying. I just wanted to say that the update on the polio vaccine campaign is that the polio vaccine campaign was done. It was in 3 phases: Central, South, and North Gaza. It was done in 8-hour polio pauses, literally 8 hours when theoretically bombs weren't falling, although they were. And then, the military would regain its bombing intensively. And there were 520,000 children under the age of 10 who were successfully vaccinated. And now they have to do the whole thing all over again, for the second dose. The 2 big concerns, and I'd love for either of you to speak about this, is that I understand that malnourished children don't mount a good immune response to a vaccine compared to a nourished child. And I also understand that measles is a tremendous risk in Gaza. And I'm wondering why the measles vaccine wasn't added to the polio campaign, because they could have gotten those children during that moment. Do either of you have any thoughts on that?
Arham, you've dealt with polio, so I'll defer this significantly more. I've seen it a little bit in Afghanistan, but with your training, I would like to defer this one to you on the polio, in particular with your training from Pakistan.
Yeah, sure, absolutely. So, the polio vaccination, it's such that, yes, it does require 2 separate dosages over, a set period of time. And, I think with the polio vaccine, it is so easily preventable and eradicated throughout 98% of countries in the world. Pakistan and maybe 1 or 2 others are the only countries that are left that had it. And now, unfortunately, here it is back, and it's reemerged in Gaza, in Palestine. And it's only a matter of time, that it continues to spread. And I anticipate that one of the major reasons that Israel somehow agreed to this polio vaccination campaign is that it does put their own immediate population at high risk. Once it's found in the soil, once it's found in the wastewater, there is cross-contamination, and that we do know that there is, spread of polio. I'm seeing here in the comments here, the polio virus loves war, and that's true. It seems to thrive in war-type situations. So it may, although I acknowledge that it's not necessarily a biological agent for warfare, now that it has emerged, one could argue that potentially Israel is utilizing it as an agent to continue to inflict harm and injury onto the population of Gaza.
I mean, I read that they would bomb at the times when families were going to the places to get the vaccine, because they were both places that people went, and then there were people who went tent to tent to tent looking for children. So it was a pretty horrific setup, but they managed to do 520,000 children, which is extraordinary.
It is. And I also would like to say that it just shows when there is a will, it can be done, right? One of two things I'll say the first time is to address this is I neglected to mention that deconfliction means by air only. So it does not cover ground and it does not cover Navy. And it's a specific route for a specific period of time. So if there is traffic and you need to go around, or if there's a car stall, then you need to go around, you're no longer deconflicted. If the person next to you is deemed a target and you're on a deconflicted road, you are still going to get blast injury and debilitating death or trauma from that. That does not, sort of in any way protect. But you just see that WHO and OCHA in particular, UN OCHA, was extraordinarily apt and wanting to do something for a very long time. And once they were allowed to with these pauses, they're able to do it. It just shows that it can be done.
And just very briefly, Dr. Rothschild, since we were talking about surmounting an immune response as well, I would like to make a comment on that. So certainly many vaccinations are contraindicated if you don't have the appropriate weight or nourishment. So one that I could think of off the top of my mind, newborn babies that are born under 2,000 grams, so 2 kilograms, or just under 4 pounds, the hepatitis B vaccination, which is standard routine given here in the US, is actually delayed. And the reason for that is that the child will not surmount an immune response to it. There is no point in giving the vaccination. So I don't think the details are known exactly regarding contraindications for poliovirus in terms of the setting of malnourishment, where now we're trying our best to it's kind of a full shotgun approach, try to do whatever you can do. It certainly doesn't seem like it will cause any harm. But I won't be the least bit surprised if unfortunately, many of these children do not surmount a response. I also will not be surprised if the polio vaccine and the sub-serotypes of the polio virus doesn't mutate and it's resistant to this vaccination campaign.
Phil, I have another question if you don't
Yes.
have a question.
No, go ahead. You stole my question about polio, so.
Okay. So what's happening is that I do this, curate this weekly report. So I'm obsessed with all of these numbers. And one of the things that I'm obsessed with is that there are a lot of babies who are born in tents, in shelters, in people's homes who die and who have never been registered. And so I fear that there's a whole cohort of newborns that were never registered as having been born and died. So there's an undercount of the number of children that are not making it. Is there any talk of that or any information on that?
There is no doubt in my mind, just in that simple 2 weeks that I was there working in the neonatal ICU, there is no doubt in my mind that the numbers are incorrect. Now, it's very easy for me to extrapolate that from infants to other children to adults, but let's not even make those assumptions. Let's just talk about the neonates. Let's just talk about the infants. On a daily basis, we are performing CPR and watching children, unfortunately, perish in front of our very eyes, yet alone the ones that weren't able to make it to the hospital, yet alone the ones that are still stuck under the rubble as we speak, whose remains remain there and who will likely decompose along with the concrete. So there's no doubt in my mind that unfortunately we do not know the appropriate numbers, that whatever is recorded is severely underestimated, unfortunately.
Yes.
And like we said, so many of these diseases are preventable, or had some of these children just been born at a different time, not even, still in Gaza, fine, still in Rafah, still in a different area, but just 6 months earlier, they would have survived. Some of the most common preventable diseases, something known as apnea prematurity. These are when children they're born too early, their brain is immature, and they don't have the stimulus to breathe. So here in the US, here worldwide, we give them a very simple medication. It's called caffeine. We all take caffeine on a regular basis. We do give it to children. Unfortunately, I spoke to this one family there. They had used in vitro fertilization for 14 years, and they finally were able to deliver a child. And this child survived birth in a tent, survived travel through the rubble, only to die in front of the hospital staff because his medication for apnea or prematurity, this caffeine, this life-saving, something that only cost cents, had run out, and we didn't have any to give, and this child died in front of us.
That's powerful. I would also comment that, as you noted, casualty numbers are actually higher than have been. I haven't seen the needle move. I don't know why. It's after 40,000 in March. I really have. If anyone can answer that question, I'd be very
It's
interested.
over 41,000 now.
But it's September
I mean, as of
Yep.
this week. Yeah.
as of this week. But I feel like, well, not I feel like there's an article from the Wall Street Journal earlier this year, probably in February, when the numbers had become hazy and people had questions around that, saying that actually, and this is from the Wall Street Journal, so it is not a liberal rag, as some might, it is a conservative paper, that the casualty numbers are actually higher because of those stuck under rubble.
Yeah.
And I want us also to think about, we're talking about what we saw in the hospital. Now, what does it take for a family to get to the hospital? If you have 7 children and one is kind of sick, but not really, and you're only the mother, dad has been killed already. The kinds of survival math that people have to do to see, well, if I take this one, who's going to care for the rest? And if I die going there, because it is very high risk to go to a hospital. If I die getting there, or if my child does, what else are we who is providing for the rest of them? So, I mean, I'm a mother. I would probably wait it out and stay in a shelter until I couldn't wait any longer. So you're seeing the sickest of the sick before you even get to the hospital. They are already making decisions that are inflicted upon them.
So I
Yeah,
have a
in terms of
question.
the numbers, the Lancet had an article that the number of direct and indirect deaths is, judging from previous conflicts, is somewhere between 3 and 15 times greater than the number that are reported. So if it was 41,000 this week, then you multiply that between 3 and 15 to know the actual number of people who have been killed either directly or indirectly from this horrific tragedy. I think, Phil, unless you have something to say.
Well, yes, one thing I remember reading early on that the official death count was based on deaths that occurred in the hospitals, or people who had died and their bodies were brought to the hospitals. Well, there aren't any hospitals left. So counting the dead to begin with is far more difficult task than it was at the very beginning, and we'll never know. We'll never know.
I don't know if you heard, but on September 1st, Shifa Hospital reopened a redone outpatient clinic that they had converted into an emergency room. They have 70 beds, and they have some basic labs and x-rays and stuff. And they were unable to get any new equipment or beds or anything. So everything was salvaged from the rubble and then refurbished to create this 70-bed emergency room. But it could get bombed tomorrow. So that's the kind of hospitals that they've got.
Yeah.
Yeah.
I think it's time to open this up. Okay.
Yeah,
Open this
so-
up to
One thing I was going to say is to be mindful and really an ethical thought around aid work under an occupation is they have a healthcare infrastructure. And I'm really glad you brought that up, Alice. They have hospitals. And are we, as aid workers, contributing to a parallel system that is then undermining their own healthcare work? And, we only do what we can and with the best of intentions, of course, but it's really important to be intentional and mindful, because that will be presented by people as a solution is, but we can just have it flooded with NGOs, which of course, number one, isn't happening. And number two is undermining people that are already highly equipped to deal with the circumstance and know their culture and know the language and are best served to treat their own communities. So for us to really interrogate ourselves as well on that front. I'll let you moderate. I think there's a question on the American Academy of Pediatrics.
So there's a question from Amy Hagopian. Has the American Academy of Pediatrics said anything at all yet on the assault on Gaza's children?
No, and the response that has been shared with those of us who ask questions around this is that they don't um, uh, comment on specific conflicts, on specific
Did
wars.
they
Now,
comment on Ukraine?
they did not.
Oh.
Now, they do have a renewal of children in conflict zones on their statement of that coming up, and that is one way we are working. Okay, same response. Yeah, that is one way we are working within AAP to get another renewed statement to include that, but has been challenging.
Rachel, did you want to comment on the APHA saga? American
Uh,
Public Association?
Yeah, Amy could chime in too. Yeah, a year ago, APHA distilled. We were forced to distill an 11-page policy down to one sentence, where APHA did sign on for a ceasefire, which, it's the largest public health organization in the United States, one of the largest in the world. So at least we got a one statement passed through the governing council, and we considered that a win. And this was last November. So this was not quite a month, or about a month into the latest siege in Gaza. And the way things work at APHA, that's considered it was a late breaker. It only stays on the books for a year. And what's supposed to happen is then the authors of that statement, which include some of us on this call here today, then write a fuller statement that goes through the regular policy process of the American Public Health Association. And we submitted that in the late winter, early spring. I think it's February, actually. I think it was due. And then in May, there's a whole process of review within the organization, which I will not bore you with. But instead of them coming back with a negative review, but allowing it to still go forward through the review process, which is usually the case, even if you get a negative review versus a positive or provisional review, you're allowed to revise the policy and continues to submit it for a second review. And then ultimately, if it even gets a negative review, it goes to public hearing, which occurs right before the meeting, and they've been doing it for the last several years virtually before the actual meeting in person, which is in a month's time. And instead, what they did was our policy and one other was just eliminate the proposed policy entirely and said that it's just not acceptable, period. And we won't allow it to go on and to be reviewed and revised and continue to go through the submission process. So we feel, those of us that are active in the organization, that this is against the actual internal policies of the organization, the way these two policies were basically eliminated for consideration. But the response has been, no, it isn't against the policy, that the executive board, upon the recommendation of this joint policy committee, could indeed do this. So we have pushed the executive director, Dr. Georges Benjamin, to continue to push forward policy initiative, not policy, legislative initiatives supporting legislation for ceasefire on the basis of the late breaker. But now here we are coming up again to another year, and it will expire in a month, or less than a month. Yeah, a month. And so we are writing another late breaker right now to continue to put pressure on the organization. But we feel that this is clearly suppression of strong public health anti-Zionist voices within the organization.
So I'm looking for more, this is an ethical crisis in American medicine, I think. And there have been some articles about that. Adam, do you want to talk about the European Academy of Pediatrics statement?
Sure, yeah, I just came across this about maybe a week and a half, 10 days ago or so. So the European Academy of Pediatrics, which is kind of the equivalent of the AAP here in the US, the American Academy of Pediatrics, it's the largest pediatric association throughout all of Europe. They put out a statement on August 1st, and I think it was published just recently on September 1st here in ACTA Pediatrics. The statement, I think, is certainly a step in the right direction. It does call for a ceasefire. It does call for, moves towards a permanent ceasefire as well. But unfortunately for me, it is still lacking quite severely. First and foremost, the mere fact that it's been published now 10 months, at the time, 10 months, 11 months later, we're already so late. So that's the first aspect of it. The second aspect of it is that there's no mention at all about the devastation that's going on with children in the West Bank. There's no comment at all about an end to the ultimate source for all of this tension, the ultimate source for all of this disaster, which, in my opinion, and I think the opinion of the overwhelming majority, is the illegal occupation of Palestine. If you call for a ceasefire, but you do not call for an end of the occupation, you ultimately have not solved the problem. Just as if a surgeon places a Band-Aid on a lacerated artery, sure, you may not see the bleeding anymore, but ultimately the problem has not been addressed, unfortunately. So that's one of the main statements I think that is lacking. And the secondary statement that is lacking as well is that it calls for a release of all hostages, which I think all of us unanimously support. Please release the hostages. But there is no mention at all of the over 10,000 children that have been held captive in Israeli prisons without representation, that have been detained illegally. Those are hostages as well, unfortunately. And there's no mention of their existence, yet alone of their release either. So although, I think we're relieved and happy to see that there is some support from the European Academy of Pediatrics, as I speak to my fellow pediatricians, we are the voice for the voiceless, and our voice should be the loudest, but very clear that we advocate for the preservation of life, for the preservation of well-being for all children globally, wherever they are, unequivocally.
Absolutely. I think what's frustrating for myself, and maybe probably many of the people that are joining us, is that, again, I have advocated, I have gone to the White House, I have met with ambassador to the UN, and this was in January, and I have done the advocacy on the Hill. And I have adjusted and readjusted managed my expectations, even around ceasefire, and have tried to work within the mechanism of all that is being, again, inflicted upon the population, and say, okay, well, can we get a bar of soap to northern Gaza? Can we do that? Can we get diapers? Can we get dignity kits? And I feel that if the bar is so low and we're still not being able to manage that. I had meetings at the State Department, and again, as our moderator Phil, you said, no one can say they didn't know. It's true, and there's a great, I can't speak for the U.S. government and their intent, but I know that there are also good people working within that system that are definitely trying, and if they are not having success, then I don't know where else to go.
Okay, there's a question from,
Yeah.
let's see, it just went away. Where is it? Okay.
Farzana.
Lisa Goldman Huertas that says, I'm in breastfeeding medicine and would love to support colleagues working with breastfeeding mothers to support lactation, relactation, and wet nursing during and after this extreme young child nutrition emergency.
Yeah, that was my question. I'd love to, if anyone knows some colleagues to connect with. I was thinking about this as I was hearing about NICU specifically. So I'm, within the United States, I'm a member of a new specialty, so breastfeeding medicine. And I'm, in complete awareness that my specific training and skill set may not be immediately transferable, but a good portion of it, I'm thinking could help support colleagues. I mostly would want to find out what their needs are. If they have any, if there's anything that I could do to be supportive, basically. Thank you.
Thank you. That's really generous and kind. When I was there, we had significant internet difficulties, and I tried for 3 days to have a WhatsApp meeting with someone that was maybe 20 minutes down the road and was unable to. Arham, I don't know if you can speak to whether those internet capabilities are they shut off at specific times, and whether that was improved during your time. I'm sure you can probably speak to during my time there. I had almost zero connection, even with my husband and my family members.
Yeah, I would agree. It's so interesting. Although we do see a plethora of video and footage, on social media platforms, for the life of me, I don't know how they're able to post these things, because during my time there, the internet access, despite as healthcare workers, we were provided exclusive Wi-Fi access for the hospital that we were in. Even then, it was a complete nightmare. So to trying to do video conferencing and telemedicine, I think we've had multiple conversations with multiple different hospital heads, and at this current time, it's unanimously impossible. Now, certainly, I do think there will be an opportunity to maybe move forward with those steps down the line, maybe in the next phase. And we certainly appreciate, Lisa's comments and contributions, and just a mere thought and intention. Believe it or not, Lisa, when I communicate this, the people that I know there, they will be floored with just the mere thought of you trying to help and thinking about them.
Whoever has a young child, could you mute yourself, please? It's lovely
Yeah.
to see a child's voice, but they're not on the webinar right now.
Yeah, I think that's Lisa.
Okay.
Yeah.
Um,
We
clearly
have
a-
a hand up,
um,
Farzana Jalali. Can we unmute her
Okay, let me see. How do I do that?
or him? Sorry. Don't know.
I asked to unmute. We weren't set up
There we
to,
go. There we go.
I think it's just by mistake. I didn't.
you
Oh,
don't
you
have.
didn't mean
okay.
to
I
raise
was
your
just
hand.
listening.
Okay, because
but
you were.
Okay, so the next
sorry,
one
I
is
just
Mark.
entered and something, I just want to listen.
Okay, so Mark Rose is the next one up.
Oh, thanks a lot. I'm here in Portland, Oregon, and I think our gratitude is to you for going over there and showing up here. I have a bunch of questions as usual. Could I put maybe the first one or two in chat, and then everyone can read it and then see if you want to comment on it?
Sure, that'll be fine.
See if,
Okay,
let's see. Make sure I don't try to copy too much. The first one is on trauma, especially emotional trauma. Oops.
Do you want to put them in the chat and we'll have someone else ask a question while you're typing?
Yeah, I'll put in one or two. I won't.
Okay.
I
We
won't
could-
bury you. But yeah,
okay,
somebody
and
else
then-
can ask. Yeah,
And then I will read them once you put them in. How's that?
yeah.
So Mark Rose is asking about emotional trauma. He said they in Portland had seen the film When Olive Trees Weep, which is an incredibly powerful film, and have heard from people who've done trauma care in Gaza. And they're wondering about the level of psychic impact on the people of all ages there. And he says, a few months ago here in Oregon, a loud noise scared me for a moment. I wonder what it is like to be exposed to constant bombing and explosions. Do either one of you want to address that?
I mean, I was only there for a short while, and it is jarring. I come to it with my own trauma from the Beirut blast, but I hear a car backfire just now, and it will still put me on edge and completely take me back to that. And I can't imagine. We were living side by side with a Palestinian family that had children, and in one in particular had almost as if he was aged in a child's body. I mean, this is not a very clinical description because there are not that many clinical people, or if there are, I want to make this accessible to others, but like he had the mannerisms of someone that was much older than his age, but was in a child's body, and it was quite something to see. Of course, we could talk about PTSD, but I think, Arham, you mentioned the drones buzzing overhead, and I the never getting a moment of silence and the gnawing that creates is so different than every other conflict zone. To not be able to hear birds, and then when you have quadcopters or the multiple drones that are above and scoping, it just completely embeds in your brain, and you cannot even process your day's events. You don't even have the luxury of silence. I can't imagine what it's like. Kids are not playing. Education is at a standstill, schools, and so on. And then, of course, in terms of mental health, we have no idea of sort of the cataclysmic effects of this because we can't document it. And all of the mental health care requires continuity of care, which is almost impossible given the restraints on transportation.
So the Gaza mental health community mental health program, which was a prominent group before the war, has put together these small clinics in the South that are doing what they call psychological first aid. But I think that's the only kind of mental health care that is happening, because you can't have mental health if you're not safe.
And I correct me if I'm wrong, but because we met with the original founder and the staff there, the Gaza Community Mental Health Program has been bombed, correct?
Yeah, the main building is totally destroyed, as is their main building in Deir al-Balah. So they have these little small clinics they're doing this aid out of.
Yeah. And if you're a child of the age of 16 or 18, I believe you've already been through 3 or 4 wars in Gaza. So
6.
6. Thank you, Alice. Yeah. Yeah, it's unthinkable.
What was the name of that building or mental health center that had been destroyed again?
It's the Gaza Community Mental Health Program.
Thank you. And their main building was destroyed.
I would also like to make just a couple of comments regarding trauma as well. Again, with the preface that I was there for a mere 2 weeks, not for a long period of time. And I echo Dr. Jelani's statements. Those drones are nauseating, unbelievably so. It is, it's one thing to not be able to concentrate, not be able to sleep, but to know that you're constantly under surveillance all the time. It is an absolutely directed active form of mental trauma for the Palestinian population that's there. I will also comment that, while I was here, 2 instances brought me back almost immediately. The first was on the 4th of July and hearing the fireworks go off. And I thought to myself, if I am being so emotional right now, what is it like for the Palestinians right now? What is the level, extent of trauma that they've gone through? The second personal moment that I'd like to share is that I recently went to a family member's house, and due to forest fires here in Southern California, they had all of their trees chopped. And this is when I had first come back from visiting, from going to Gaza. So I went to the backyard, and just instantly looking at their backyard, their trees that were barren, completely took me back as if I was back in Palestine again, because everything there is barren. Any vegetation, everything was completely scorched earth, right? So now moving from my own personal trauma, which we should not focus on at all, we should focus on the Palestinian plight, right? So looking at those individuals there, when we talk about the healthcare personnel, these individuals, I spoke to the head of the Emirati hospital, the head of the NICU at the time, Dr. Muhammad Salama. He has 3 young boys. He used to tell me that, look, I'm coming into the hospital. I buried my grandfather or my uncle earlier today. I'm here. I do not know if I'm going to be able to make it back home. I do not know if my family is okay. We don't know if the next patient that comes in, is that our family member? Is that our neighbor? To go through that psychological trauma on a regular basis. As Dr. Brewer had mentioned earlier, I spoke to neonatologists. These are the young baby doctors who mentioned that they were forced to make formula out of seawater. And for those that are not in healthcare, this is a death sentence. So to know that you're providing your patients with essentially a poison, these physicians, they expressed so much guilt when they were telling me these stories, but they never went into medicine knowing that at one point they would be poisoning the exact patients that they were there to take care of. The psychological torture and the trauma that these individuals are going through, these healthcare staff that are there, they are incredible human beings. They are absolute superheroes. They are inspiring. And I will be the first to say that other than one patient of the hundreds that I treated there, I don't think I provided anything additional that they did not already know. They have the intellect, they have the strength, they have the capacity to do it all, to take care of it all. They are just left with no supplies, no aid, and relentless shelling and personal trauma that they're trying to cope with as well. Thank you.
Absolutely. I echo that. And I would also say that there is no healthcare system on earth. I work at the largest medical center in the world at one of the, big academic children's hospitals, and I trained there. There is no system in which that they can manage sustainably the mass casualty after mass casualty that this population has been subjected to. And then to evacuate. So our hospital was indeed evacuated. So how do you evacuate children in incubators? How do you evacuate a NICU baby? How do you evacuate children who are so burnt? And there's also, we haven't talked about the generation of orphans that have been birthed from the conflict as well, that have they're so burnt that their eyes are swollen shut and that they are barely able to breathe. How are they getting out of the hospital? We'll never know. Or are they, right? So there's so many dynamics to the mental health of children parenting way too young and assuming the roles of parents as well.
So I believe Maxine Fuchsen had your hand up and,
That was a mistake.
oh, okay, okay,
I'm happy to listen.
okay. So we have about 10 minutes left. If
Afshan Jalani has her hand raised.
Oh,
Thank you. Good evening, everyone. Thank you so much for making this presentation. Every time I listen to some of the speakers here, it really makes a huge impact. And it carries forward to the people that I know in the organizations that are working alongside with you to make some change. Even the smallest amount of good out of it, it's definitely worth it. So I appreciate your time. I have a couple of comments. It seems like they're beginning to bring some children from Egypt to the US for medical treatment, and most of it is orthopedic and psychological. If somebody could point me in the right direction of what resources may be available in the US, in Houston specifically, I would really appreciate that. And the second comment or question is, given that the elections are so close upon us, do you think that y'all would be changing your approach to seeking a voice or some ear in the White House? And if so, what do you think is going to be the outcome if Harris indeed wins the vote?
Yeah, good observations all around. The first was around people evacuating Egypt, and that evacuation is largely shut off. There are few people coming through, from my knowledge, and they're getting through other mechanisms, not Rafah, but Kerem Shalom as well. Let's talk about first in Egypt, what they're subjected to, in Egypt and in Turkey as well, or other places. So until recently, I believe I'm full disclosure, I'm on the board of an NGO called Inara, which is run by a former senior correspondent for CNN, Arwa Damon. And so this is my source of information of all the work that we have been doing in these areas. She's since gone into Gaza 3 times during this war. In Egypt, they're not allowed to leave their hotel rooms or their hospitals. They cannot attend school. They are not citizens. They're subjected, as Palestinians are in many of the Arab countries, to some of the same indignities and not entitled, and certainly not receiving the standard of care that they would otherwise. Likewise, in Jordan, we know in Lebanon for sure that they are banned from over 40 different jobs as well. The trickle that is coming through that are being medical evacuated, because I have worked on Medivacs, and advocating for them. A great organization is HEAL, which I know you know, HEAL Palestine, that has and addresses these from a multidisciplinary level, so psychosocial and so on. Inara does it as well, but on a much smaller scale. The elections, I mean, I'm not a political scientist. I don't pretend to know. I know that there are people in this administration that are sympathetic. I know this is really hard for Chris to hear, and I want to just take a moment to acknowledge there are people in the administration that are sympathetic and feel that their hands are tied. I am not presenting an excuse. I'm not presenting anything that would I'm just telling you that that is some of the sentiment that I have received across Department of Defense, Pentagon, and State Department, White House, and National Security. Some of the sentiment that I have heard from.
So we have about 6 minutes left. Is it time to ask you for closing remarks if we don't have any other questions?
There's a question in chat, but if you don't have time, it's about population registry control and the numbers involved.
Oh, I'm sorry, you cut out. I couldn't hear you.
I'm just saying there's a bit of a wordy question in chat about basically whether or not Israel still controls the registry in Gaza, as they did after 2005, so-called unilateral disengagement. One of the things that made that a lot still controlled, I think, population databases for Gaza. And insofar as that may still be true in some ways, it meant that the casualty figures we were getting could probably be trusted, and if anything, were undercounts, not overcounts. So I wondered if anyone knew anything about these databases and who's been controlling them.
I can speak to that just from what I've read, and that is that there is a population count by name. Every individual is counted, and that's kept by the Gazan health authorities, as well as the Israeli government. And if there is a census when all this is over, that's when we're going to find out what the true death toll is.
I'm sorry, you're saying the same registry?
We
this maybe not that important.
5 minutes, so I think we need to move on.
Sure.
Okay.
What I will say is that Israel has not approved registration for an international NGO in over 10 years. And I say that as somebody that was with an international NGO that had to work through other mechanisms and to do so. Is extremely, and what's very interesting, what I would say is like, this is otherwise one of the most accessible places. You can get to it literally by land, air, and sea. So it should be very accessible, actually. It should be very easy. All of these things are, people say they're man-made and whatnot. I prefer the word engineered because it takes quite a mind to be able to stack up the layers to say no water treatment tablets and then polio and so on and so on. And so now we're chasing our tail with polio vaccines. When I get to one of these comments, going back to Seema's comment, large number of orphan children, do we know who's taken responsibility and how are local families? So that's a great question regarding the orphaned children. Oftentimes it's the extended family. So the village is very much alive in Palestinian communities, and it's often extended families, neighbors, even when extended families are gone. For instance, for the wounded child, no surviving family. I've seen neighbors. Now that entire system has also disintegrated, right? Because neighbors that you might have known in the north, if you're in the south and then traveling to Mawasi in the west, those people are also lost. So then you have this like a subculture of orphans taking care of orphans. Ms. Cott, I was responding to that. But that's what I have seen is complete manufactured chaos and anarchy.
My brief comment regarding orphans is a scenario that I witnessed myself with my own eyes. I was working in the neonatal ICU, and one day these two young women entered into the ICU. And, given that they were of childbearing age, we thought that maybe they had a child to ask us a question about or to treat, but rather they came in with big smiles on their faces and they requested, are there any orphans? They went to inquire, are there any orphans in the ICU right now? And if there are, we are here to take care of them. We are here to take care of our orphan neighbors, brothers, sisters, cousins, whoever they may be. We're here to provide those efforts. So the Palestinian people, as a community, they look out for each other. Despite the under overwhelming circumstances, their generosity is unmatched.
And I would close with that in deference to the Palestinian community who really should be speaking in our place here. I know, Arham, you share my sentiments on that, that it should be enough that they have told us and have showed us, and how many more videos do we need to see in the palm of our hand as they are being erased and desecrated with no dignity even in burial, as we've seen. And I will just close with that and just have them at the top of mind. And so one last thing, sorry. There was a young lady, a physician who had already been displaced 2 or 3 times, and she came from Shifa, and she said, but I don't want to be resilient anymore. And that struck me. We keep on calling. There's a point where they don't want to, and they shouldn't be forced to be these heroic figures. They just want to live a life with dignity.
Well, I can't think of a better closing thought or remark. On behalf of the Health Advisory Council, thank you so much for being here. Thank you, audience, for your participation. We will have a Palestinian next month. Mazen Kumsaya will be our guest, and will be able to speak from the point of view of a Palestinian. So thanks everyone for joining, and hopefully you'll come back next month as we continue this series. Alice, I think you should have the very last word.
Well, I do encourage people to go to our website, jvphealth.org, and sign up to receive the weekly messages, as well as announcements about events and petitions and that kind of thing, and to keep working on getting our medical colleagues to speak out on this topic, because it is really a lapse of medical ethics that there is so much silence in our country. So that's how I would end this, with a call to action. So thank you.
Good
Take
night,
care.
all.